Hi friends, welcome to our channel Young Ophthalmologist. In this video, I will show you the basic steps of Phaco by stop and chop technique. When I start a case, I always coat the cornea with the visco. It increases the clarity and gives a crisp vision to us. And we get all the details of the lens, any posterior surface opacities. So now we are making an incision. I usually use 2.8 mm incision because through it all Indian and foreign lenses can go. We make a 3 planar incision to enter into the eye, and it is at the posterior limbal site. Now it's time to put some air because we will be using blue dye after that. This air helps in staining the anterior capsule properly so that the endothelium is not damaged by the blue dye. Now we will wash out the blue dye with the use of dispersive visco. And always remember to remove the complete air because even a small air bubble left inside the eye can cause problem in the capsulorhexis. Now we are using a 26 gauge needle capsulotome to make a capsulorhexis in the anti-clockwise direction. It should be of the size of at least minimum 4.5 to 5 mm, which makes the manipulations during phaco very easy. As you can see, this air bubble is there, so it hinders the margin of the rhexis. So always try to remove the air before capsulorhexis. The force should be centripetally, so the rhexis should not go out. As you can see, we have a 4.5 to 5 mm rhexis now. I use side port, also called lens tip, 3 to 4 clock hours away from the main incision. Few people use MVR also, so you can use any instrument you are comfortable with. Now it's time to do hydro. So I use hydro cannula, normally 24 gauge cannula or 27 gauge cannula, depending on your comfort. First we are doing hydrodissection, then hydrodelineation. You can see the golden ring. So it gives a cleavage in all the planes. You should take care that while doing hydrodelineation and dissection, the decompression of bag is compulsory to avoid any pressure creation behind the nucleus. So PC rent can be avoided. In between, you can use visco over cornea to make the clarity better. Now it's time to rotate the nucleus. I always rotate all the cases. It makes the phaco easy. Now it's to start the phaco. So I use a dialer. It's in phaco 1. So here, as we are demonstrating stop and chop phaco, first you can eat all the epinucleus. So you can directly reach to the nucleus. Now you can make a small trench 1.5 width of the phaco tip. I use Earthly Easy Phaco machine and it's very good. I'm using from last 7 years. No financial interest. In stop and chop, I normally do the tunnel making in one direction only. With experience, you can make the tunnel complete length without rotating the nucleus. The tunnel should be at least depth of 90%. You will see red glow. And while breaking the nucleus, you have to go at least 90% depth, and both the instrument, the dialer and the phaco probe, should be at the lowest point of the tunnel. Now I am using the vertical chop and picking up the piece. The care should be taken that the pieces should be brought to the center. It should not be, phaco energy should not be delivered in, now it's in phaco 2, and phaco energy should not be delivered at the periphery. So it should be in center because there we have the maximum space so that cornea is also not damaged and the PC is also away. While doing that trenching, you can break the nucleus with two dialer also if you are not comfortable with the phaco probe and a dialer initially in your first few years. Now the nucleus is eaten. It's time to take the epinucleus. I always remove the epinucleus with phaco 3 where the vacuum is almost 180 mmHg and power is also only 25%. So it helps to avoid any kind of PC rent while removing the epinucleus. You can use the dialer help to take out the epinucleus, but be careful. The epinucleus below the incision is difficult to remove, so don't try too much. I normally use coaxial IA at a vacuum of 400 or 420. It do the cortex removal very fast. As you can see, care should be taken that full vacuum should not be applied at the periphery near the rhexis margin. You should bring the cortex toward the center. Here we are doing the polishing. You can do polishing with coaxial also with irrigation on. Now it's time to put the lens. Here I am using Hoya Impress lens. It's an advanced monofocal lens which gives some vision for computer use. It's a preloaded lens, very easy to put, very smooth. Now you can see the lens is dialed and kept in the bag. Both the haptics are in the bag and the optic is well covered with the rhexis margin. Now it's time to wash the remaining visco. I use the coaxial. You should wash through all the angles first. Any matter stuck in the side port can be removed with the help of a dialer. So here we are washing the visco. You should give it some time, and you can also go behind the IOL to remove the visco so that next day the pressure will not be increased. With coaxial, it's little bit tricky to go behind the IOL, but with experience you can go. Just take care that the tip is properly exposed and the sleeve is properly pushed back. Now the case is complete. I am hydrating the wound. You should hydrate the main wound first, both sides, both ends first. Properly take care, don't push too much, and always watch over the desmids. Now the side port is hydrated and the case is done. If you people have any questions related to Stop and Chop, please comment below. I will give the